the vagina. It is a tube 8 centimeters long and is lined by stratified squamous epithelium. It opens into the vestibule of the vagina by an opening which is guarded by the hymen. This is the remnant of the hymen. The vagina is directed upwards and backwards and is directly related anteriorly to the urinary bladder and the urethra, and is related posteriorly to the recto-uterine pouch, rectum, and the perineal body from above downwards. This is another specimen showing the urethra open longitudinally and is seen adherent to the anterior wall of the vagina. This is the external urethral orifice, and this is the internal urethral orifice. This is the posterior surface or base of the urinary bladder. It is also adherent to the anterior wall of the vagina, and this explains how the bladder can herniate through the anterior wall of the vagina to form what is called cystocele. This is the ureter, descending downwards and forwards and medially on the floor of the pelvis. It comes close to the side of the cervix where it is 1 inch apart. Here it is crossed by the uterine artery. The ureter then continues on the side of the upper part of the vagina and then in front of it, especially on the left side, to enter the urinary bladder. This is the vaginal artery, which arises as a branch of the internal ileum. It is the inferior vesical artery in the male. It supplies the vagina together with some other branches coming from the uterine artery and the middle rectal artery. This is a vaginal branch which descends from the uterine artery. This is the urinary bladder open, and this is its neck. These are the pupovesical ligaments stretched between the front of the neck of the bladder and the back of the symphysis pubis. This is the vagina immediately behind the urethra and the bladder. This is the levator ani muscle lying on the side of the pelvis, and this is its anterior free border. Notice that these most anterior fibers of the levator ani get attached to the side of the neck of the bladder as well as to the side of the vagina, where it forms what is called the sphincter vaginae. This is a hemisection to show the parts of the vulva. It comprises the two labia majora, two labia minora, clitoris, and the orifices of the vagina and urethra. This is the labium majus. It is a fold of hairy skin filled with fat. The cleft between the two labia majora is called the pudendal cleft. This is the labium minor. It is a thin fold of skin devoid of fat and hair. The labium minor lies to the inside of the labium major. The cleft between the two labia minora is called the vestibule of the vagina. This is the external urethral orifice, which lies immediately above to the vaginal orifice and is only 1 inch below the symphysis pubis.